it's Dr. Hodges again. Today I want to talk a little bit about revision surgery. This is going to be part 2 of my series of the different types of revision bariatric surgeries that my patients can undergo. Previously I spoke a bit about undergoing lap band revision, and today I want to talk about sleeve revision. You know, right now in the United States, the sleeve gastrectomy is the most widely performed procedure. It is performed hundreds of thousands of times. And unfortunately for a lot of patients, they just aren't getting the weight loss that they need, or sometimes they're having some really bad symptoms of reflux, difficulty swallowing, and they just are seeking out a way to get this better controlled. Oftentimes, whenever I've had patients come to see me and they have not reached the weight loss goals that they want, when I go in preoperatively to kind of get a better evaluation of their stomach, I usually will find that they've had a previously created sleeve that was a bit too big. Patients are under the impression that they're going to stretch out their sleeve. That's not really what happens. If somebody begins to fail from their sleeve, it's usually because of 2 reasons. Either the sleeve was just created a little bit too big, and or the patient just was not using the best dietary habits. Patients can kind of learn to eat through a sleeve, meaning they can drink high-calorie liquids, they can graze throughout the day, and those are certainly things that can contribute to some weight regain. However, it is imperative that your surgeon gives you a nice, good, aggressive sleeve if you want to meet that goal of losing about 65% of your excess body weight. That's about 65 pounds for every 100 pounds that you're overweight. So generally, whenever I have a patient come see me, they really haven't met their weight loss goals. Sometimes they're having reflux so bad after their sleeve, they're sleeping on 2 or 3 pillows a night, and this is despite them taking acid blockers once or twice a day. When I have a patient that comes to see me with a sleeve that's failed, I generally will offer 2 different types of revisions, and both of these are performed laparoscopically. Either a revision of a sleeve to a bypass or a sleeve to a duodenal switch. Generally, if I'm performing a sleeve to a gastric bypass, you're going to lose about 10% less than someone that's undergone a gastric bypass from the get-go. So if you're going from a sleeve to a bypass, you'll lose about 65 to 70% of your excess body weight. If you're a patient that is wanting to undergo a sleeve to a duodenal switch, you'll probably lose about 75 to 80% of your excess body weight. What's nice is that complication rates with all of these revisions are going to be the same. Bleeding and infection happen about 5% of the time. Risk of leaks, the risk of a staple line coming apart, that's less than 1%. Mortality is 0.05%. So my patients that are undergoing these revision surgeries, they really aren't having an uptick in complications after the surgeries. What's always going to be important is that my patients are doing all of their vitamins and all of their protein regimen. So if you are one of those patients that are out there, you underwent a sleeve, you gave it your all, but you just aren't meeting those weight loss goals, perhaps a revision is going to be the right thing for you. I really hope that this information has helped. If you liked it, give me a thumbs up, and don't forget to subscribe to my channel. You guys have a nice day.